My name is Dr. Vibha Dubey. I am consultant pediatrician in SKG Hospital and visiting consultant in IIT Jodhpur and HPCL Pachpadra. Today I have come up with the topic headache in children. If you like this video, kindly like, share and subscribe because that gives me motivation to make further videos for you people. Headache is a condition in which there is pain in the temple area, orbital area and occipital area. But neck area pain is not included in headache. It is divided into two parts, primary headache and secondary headache. Secondary headache is a condition in which there is problem in some body area and that manifests as headache. And primary headache is a condition in which there is no secondary headache, no cause can be found out about after examination of the body. Then it is called primary headache. Tension headache. The most common cause of primary headache is tension headache. It can be felt as a dull ache band around head, and it can be episodic or chronic. Migraine. Migraine is the next common cause of primary headache. It happens because of dilatation of blood vessels or spasm of muscles around the head. It happens due to changes in brain signals. Because adult migraine is generally unilateral, but it is not so in children, it can be bilateral. It is generally starts with an aura. Aura can be of any time. It can be visual. Visual means seeing abnormal flashes of light. Then it can be auditory, that is listening to abnormal sounds. It can be olfactory, like we are smelling the child is feeling that there is some abnormal sensation around. The child of migraine generally likes to retire in a dark room and it takes 48 to 72 hours to heal and it is generally associated with vomiting. Cluster headache. Cluster headache is a very rare cause of primary headache. It is relatively more severe also. In this, there is severe pain. It can continue for months or it can be repeated every year. Generally, it is associated with swelling of lids, redness of eyes, droopy eyelids. There can be congestion around nose. Now coming to secondary headache. Headache can be secondary to viral infection. Viral infection are very common around the change of seasons and every children have one or two episode of viral infection in a year and it can present as headache. But there can be other symptoms also like running nose, body ache, etc. Secondary headache can be secondary to a head trauma. There can be some head trauma which is forgotten by the child and the parents also and it can present as headache. Meningitis. Meningitis is relatively serious cause of headache and it results into meninges are some membrane around the brain which protects the brain, and when there is inflammation in the brain it can present as severe headache. Then next cause is sinusitis. There can be the sinuses are the area which is around the facial bones, and when there is inflammation of the or infection of the lining around sinuses, it can lead to serious headache. Metabolic disorders like diabetes are becoming very common day by day, and if there is hypoglycemia in a diabetic child, it can also present as headache. In children, very rare cause of headache is tumor in the brain or bleeding in any area of the brain. It is not as common as adults. Now when the child presents into doctor's chamber, what history a doctor should take in case of headache? History taking is a very important part of headache. One should ask the history of severity of headache. Then what is the type of headache, whether it is throbbing headache, tearing headache or dull ache kind of headache. Headache is common in which part of the day? Or there is fever or cold or pain in the neck. How long the pain has been there? What is the frequency of pain and how much is the pain-free interval? Are there any notable symptoms that happen between headache? Does the child experience weakness, changes in consciousness or changes in vision? What treatment did you try at home? Did you try any medication? Did you try any hot or cold packs? Or did you try turning off the light and the child is relaxing and after that he gets relieved? Is there any change in the personality of the child? And last but not the least, is there any history of convulsions? Complete history, especially neurological, is taken to rule out any problem in the child. It is very important that a child gets examined by a pediatrician and if necessary by a neurologist. Although hypertension is a very rare cause in children, but still taking blood pressure is very important if the child presents with headache. Now what investigation we will undertake to examine the headache? First is the complete blood count to rule out any infection in the child. X-ray paranasal sinus is also very important, especially if the child is suffering from cold, to find out if that is the cause of headache. If in spite of all the investigation we are not able to rule out any find out any cause, it is very important to go for MRI of the brain and see the brain as a whole to rule out any big cause of headache. There is a test, really it can be done, that is called MRA, magnetic resonance imaging of arteries, to rule out if the arteries in the brain are all normal. Lumbar puncture. Lumbar puncture is an invasive test, and lastly it can be used if we are not able to find out any cause of the pain and there are associated symptoms. Here cerebrospinal fluid, which is the fluid which circulates around the brain, is taken out and examined under the microscope to see, especially if we suspect any infection. Now coming to treatment, most important thing is we should treat the cause. If the cause which is causing headache is treated, headache will go out by itself. Non-steroidal anti-inflammatory drug can be tried. It gives instant relief of the pain, but it should not be given for a prolonged period and should not be given for more than twice in a week because it has lot of side effects. Other stress relieving factors, because I told you that tension headache is the most commonest cause of headache. So other stress relieving factors like meditation, pranayam, aerobic exercises, listening to music, taking a very good sleep like 8 hours in a day, these things should be tried. And that other lifestyle changes like taking a very balanced meal, taking regular exercise and leading the life in a very disciplined manner also helps. Detailed history by the doctor also helps, and one should try to find out if there is some triggering factors like lack of sleep, some special food like sometimes some Chinese food or cheese or coffee, are they triggering the headache in the child, or some stress, is it triggering the headache in the child? Migraine is a clinical diagnosis and there is no investigation can prove that it is a there is a migraine, and doctor should take a detailed history to reach to the conclusion. If doctor is convinced that it is migraine, then in older children, triptan is a drug that can be tried to prevent or maintain the migraine, but not in younger children. So I have told you everything what I knew about headache. I think this is helpful for you, and if you like this topic, kindly like, share and subscribe, and don't forget to press the bell icon. Thank you.